Okay, we're going to be looking at array 12. Array 12. This looks at pathogens, okay? Pathogens come in a couple different variations. Oral pathogens, these are bugs, germs that hang out in your mouth. Gastrointestinal pathogens, these are germs that hang out, and bacteria and stuff that hang out in your gut. Then there's also gastrointestinal parasites that hang out down here. And then lastly, there's bacterial and stealth pathogens. These are bacterial and stealth pathogens, meaning we can't even test for these things. So this is like Lyme disease, Babesia, Ehrlichia, Bartonella. These are all things that even when you get the test done, sometimes they fly underneath the radar. We don't know whether they're positive or not. So when you get this back, we want to look at the overall pathogenic load. And what these do basically over a time frame, they can come inside the system and they can hang out. So for instance, you could have a pathogen in your mouth, an oral pathogen, that just hangs out there. And periodically you're told you have periodontitis or you get cavities. And you think it's coming from sugar. It's not. It's abnormal bacteria that's hanging out inside your mouth. Over a time frame too, you could have abnormal pathogens hanging out in your skin, in your gut, parasites. They could be all over you. And the weaker the system, the more these germs hang out, because the germs love to hang out in a weak environment. In a weak body, they'll take place and hang out and live off you. The other thing also that you want to understand is many times if there's issues with a weak brain and a weak gut, over time, especially the stomach, if it's not producing enough hydrochloric acid in the enzymes, these pathogens get right in. They get right in. Then, if you have a leaky gut, they can get inside the bloodstream and deposit in your joints, in your brain, in your lungs, in your kidneys, in your liver, and create all kinds of issues inside of you. So if you show these are not acute infections. It doesn't mean you need to run out and get a drug for an antibiotic. It means, though, that these are continually stressing the immune system and they're part of your sustained inflammatory response. And then we'll tell you what to do. If we need to take certain nutrients that help lower the load of the virus or the bacteria, we'll tell you to do that. If we need to strengthen the immune tolerance, we'll tell you to do that. If we need to talk about other nutrients specifically to raise the immune level, we'll tell you to do that. If I think brain-based care is involved, I'm going to tell you to do that. If you need more cellular energetics, I'm going to tell you to do that. So once we go over this information, you'll know whether you have these pathogens or not, how many of them do you have, and then also what you want to know is these pathogens have been shown to cause direct diseases inside humans. And the pathogens that we tested for have been shown to create direct diseases. So multiple sclerosis, other chronic rheumatoid arthritis, other chronic diseases, cancers, have been shown to directly be connected to these pathogens. And if you have these, we have to have a clear plan on getting these to be move out of the system, and how do you get things moving properly so that this can become a reduced and removed, and then over a time frame lower your sustained inflammatory response. So thanks. Have a great day.